Okay, so get this. Today's deep dive takes us all the way to Italy.
Italy.
You got it. Aesthetic medicine in Italy.
Interesting.
Yeah, so you sent over this collection of materials, and it looks like we're peeking into, well, it seems to be the services offered by a particular clinic,
Okay.
possibly Dr. Andrea Bertoli's practice.
Oh, wow.
It's like a crash course in, well, I don't know, what's hot in Italian beauty right now. We're talking lip fillers, Botox, even non-surgical nose jobs.
Wow. So are we going to be brushing up on our Italian A&D aesthetic procedures today?
Well, maybe just the procedures.
Sounds good to me.
So this clinic seems to be emphasizing a certain natural aesthetic, which I think is really interesting.
Yeah, and that seems to be a big trend these days, moving away from the really, I don't know, overdone looks.
Exactly, which is a relief, right? Like for anyone who's a little apprehensive about, some of these procedures and ending up with a result that doesn't really suit them.
Right, because it should be about enhancing your natural features.
Exactly. So speaking of natural aesthetics, can we talk about those lip fillers for a second?
Sure. What about them?
Because their materials, they really highlight this dedication to natural looking results. And, I'm sure that's a big question for anyone who's thinking about lip enhancement.
Absolutely. And they specifically talk about using hyaluronic acid-based fillers.
Which is a popular choice, right?
Very popular, and for good reason. It really creates that natural look and feel. But what I found particularly interesting was how they approach this Russian lips technique.
Oh, yeah, I saw that too. So instead of just adding volume, it seems like they're more about subtly rolling the lip outward.
Yeah, have you ever seen, like, a flower bud? That's what I picture.
Oh, I love that analogy, like a perfectly sculpted flower bud. Okay, that makes sense.
Because it's about enhancing, not like,
Well,
overhauling.
right. It's not about erasing your natural features and just like slapping on a new set of lips. It's about working with what you have.
Exactly. And this is where it gets really interesting. They keep talking about this, the arc of Cupid. The what? The arc of Cupid. It's like those two peaks at the center of your upper lip.
Oh, okay. I see what you mean.
Yeah, and it's fascinating how much emphasis they put on this one detail.
So it's not just about plumping, it's about proportion.
Exactly. It's about achieving that perfect pout, I guess you could say.
With careful attention to detail, it kind of makes you wonder, is this focus on the arc of Cupid a specifically Italian thing?
I don't know.
Like, reflecting their own kind of beauty standards.
It's an interesting thought. It's like they've taken a technique.
And they've added their own Italian flair.
Exactly.
Okay, so we've got the lips covered. What about those pesky lines that, time likes to leave behind?
Ah, the wrinkles.
Yeah, the wrinkles.
It seems they offer Botox injections,
Okay.
but they are careful to point out that it's not like a magic solution for every single wrinkle.
Right, it's not an eraser, is it?
No, definitely not.
So how do they explain what Botox actually does? Because I think there's a lot of misconception out there.
Well, they describe it as a way to temporarily relax certain facial muscles,
Okay.
almost like hitting the pause button on the muscle contractions that actually cause those dynamic wrinkles. You know, the ones...
The ones that form when you're like frowning or raising your eyebrows.
Yeah, like when you're expressing yourself.
Yeah.
And they specifically mentioned crow's feet and forehead wrinkles.
So it's like a temporary freeze frame, not a complete rewind.
Exactly.
Okay, I got it. But what happens when the Botox wears off?
Yeah.
Do those wrinkles just come roaring back?
Well, they don't exactly say roaring back, more like they explain that the wrinkles gradually reappear.
Okay, so they do come back.
As muscle function returns, yeah. And that's why, people often opt for repeat treatments.
So it's more like hitting refresh than rewind.
Yeah, I like that. A good way to put it.
Mm.
And this is where their whole thing about natural-looking results comes in again.
How so?
Well, they're careful to mention that Botox, it only really addresses the wrinkles caused by, how your muscles move.
So like not the ones from sun damage.
Exactly. Or just like natural loss of collagen as you age.
So for those types of wrinkles, you'd need something else.
Different solutions, yeah.
Interesting. Okay, so this is where it gets really interesting.
Oh.
How so?
They mentioned something called preventative Botox. Have you heard of this?
I have, yeah. It's like instead of waiting for the wrinkles to get really deep,
You're kind of like preemptively stopping them?
it's more about strategic intervention, I guess. They use these terms microbotulino or mesobotulino.
Microbotulino. That sounds intense.
Right. It seems to be about using these tiny doses of Botox to, like, delay those deep wrinkles from forming in the
Right.
first place.
So instead of waiting for wrinkles to like etch themselves onto your face, you're
Exactly.
kind of training those muscles to relax a little more
Yeah.
before it becomes a real issue,
It's like a subtle nudge towards, keeping that youthful appearance.
rather than a complete overhaul.
Exactly.
Yeah.
Exactly. Wow, this clinic is really on top of it. Okay, so we've done lips, we've done wrinkles. What about the nose itself?
Ah, yes. This is where the rinofiller comes in.
A nose job, but without the surgery?
That's the idea. Using hyaluronic acid fillers to reshape the nose.
No surgery. Okay, that's convenient. But, what can they actually do? Can they address any kind of nose shape with this?
They list a few target areas like the nasal bridge.
Which they call the GABA?
Yeah, kaba, which means like hump.
Oh, okay.
They also mention tip projection and then just any dorsal irregularities.
So they can smooth things out.
It seems that way. And get this, they even mention using it to correct imperfections left over from old school rhinoplasties.
So even if you've had a nose job in the past, you might still be a good candidate for this rinofiller.
Potentially, yeah.
Hmm.
Although they're very clear that this is aesthetic.
Okay, so not functional issues. Got it.
Right. Like a deviated septum, you'd still need to see an ENT for that.
Of course. Of course. It's all about managing expectations, right? Speaking of which, what happens if someone goes a little overboard with, the fillers?
Overboard how?
Like, say they get lip fillers, and then, I don't know, maybe it's a little too much.
Too much volume.
Yeah, exactly. Too much volume. Is that where that undo button comes in?
You're talking about hyaluronidase injections.
That's the one.
Yeah, so it's an enzyme, and it actually dissolves hyaluronic acid fillers.
Oh, wow. So it's like a correction treatment.
Essentially, yeah.
Yeah.
And they specifically mention it for, lip filler corrections, which makes sense.
Because you really want to get that area right.
Absolutely. And here's the interesting thing. You can actually get new filler treatments just 2 weeks after a hyaluronidase injection.
Really? Wow. So it's not like a permanent decision. You
Oh.
can make adjustments and fine-tune as you go.
Exactly.
I bet that's really reassuring for some people.
Yeah, definitely. I mean, it really shows how much they prioritize the patient's comfort and, getting it right,
Yeah.
It's not just like a one and done.
Exactly. So, okay, we've covered a lot. We've done enhancing lips. We've done smoothing out those wrinkles, even subtly reshaping the nose.
It's amazing what you can do these days.
I know, right? As we're kind of wrapping up here, what are some of the, biggest takeaways that you got from these materials?
Well, one thing that really struck me was the pricing.
Oh, yeah. What about it?
It seems like all these treatments, they're offered at or under €300.
Wow, that's really affordable, especially considering everything we talked about.
Right. And it makes you think about, how accessible these treatments are becoming.
Especially in a place like Italy where, I don't know, beauty and taking care of yourself, it's such a big part of the culture.
Absolutely.
So it makes you wonder, is this level of affordability common there? Or is this clinic trying to be a more accessible option?
Yeah, it's hard to say for sure,
Mm.
but I think what's important is they don't seem to be sacrificing quality for a lower price.
Right, because that's key.
Good
What
point.
else stood out to you about their whole approach?
Well, they really emphasize safety and expertise. Throughout all these materials, they mention qualified medical professional.
It's just so important.
Absolutely. This isn't the time to cut corners.
Not at all. So it sounds like they're not just in it for the money, which is reassuring.
Right. It's not just transactional. They seem to really care about the patient's experience, those consultations, looking at medical history.
It's that personalized touch, and it really seems to be at the heart of everything they do.
Yeah, it's not a one-size-fits-all approach.
From those natural-looking lip enhancements to the whole microbotulino thing for wrinkles, it's all about working with what you've got,
Exactly. Enhancing your natural beauty,
Yeah.
not trying to erase it.
Exactly. But we should probably mention, as insightful as these materials were, they are promotional.
Of course. This was just the starting point for us.
Right. So to everyone listening, if you are considering any kind of aesthetic treatment, do your research.
Yes. Talk to multiple professionals. Don't be afraid to ask questions.
And most importantly, trust your gut.
Because at the end of the day, it's your face, your
Yeah.
body.
Your choice.
Exactly.
And that is a wrap on another deep dive. Until next time.